Great. Thank you very much, Henry, and thank you very much to the organizers for inviting me to speak in this concluding session of the STI 2018 pre-conference. I'm going to present the work, as Henry mentioned, of a new coalition called HIV Outcomes Beyond Viral Suppression, and I'll try and situate the work we're doing on STIs within the broader work of this coalition. So, the state of play today, why beyond viral suppression? Well, because living a long and healthy life with HIV is a reality. Over the last 3 decades, we've seen how HIV/AIDS care has transformed markedly, from understanding the virus and providing palliative care, to the advent of art, to now an era where living a long and healthy life with HIV is a reality, not everywhere, but in most settings for many people, and that's where this work is focused on. Now, the Outcomes Initiative that we started looks at today's health and social inclusion issues for people living with HIV because we feel they're not receiving enough attention from policymakers and healthcare providers. And we aim to make these elements more central to the overall HIV response. The work we're carrying out should be seen as complementary to existing work in prevention, diagnosis, treatment, and care. It's not a coalition setting out to compete with other work, but to look at where the gaps are in the response in the beyond viral suppression era. We're looking at collaboration, partnership, and cross-boundary working as our key guiding principles. So, what is the HIV Outcomes Initiative doing? Well, we're working to ensure that people living with HIV live long and live well. Viral suppression, although crucial, is not the only outcome that matters for people living with HIV. Longer life with HIV brings different challenges that need different approaches. Developing a new paradigm for policy attention and care delivery is the core of our work. So we have a governance structure you see here with a steering group and presidents and other experts from the patient community, policymakers, industry, researchers involved. In the center here, though, I draw your attention to Mario Casco from the European AIDS Treatment Group. When Mario joined our work, I didn't know him very well, and we talked about what it was like living with HIV and why this coalition would be important for him in spite of the challenges we face in Armenia, like the previous speaker mentioned, and all over the world where we're facing not just stockouts, but even a majority of people living with HIV either undiagnosed or not on treatment, or if they are on treatment, not virally suppressed. So I don't want us to forget that when we do look at how we can also go beyond viral suppression. So talking with Mario, he told me a story that he also allowed me to write up in a blog post, and I confirmed with him last week that I could present it here with you because it's such a heartening and at the same time disheartening story. So many years ago, Mario and his wife decided that they wanted to have a family and have children, and he went to his doctor and said, "We'd like to have a child." And the physician responded that having a child, in Mario's words, he said, was a terrible idea, since Mario's wife would simply end up raising the child alone as a widow. So here you have the photo of Mario with his son. And when I talked to Mario about why we should tell this story now, he said because so many patients he knows, and in so many parts of the world, the reality is still that the medical community is not just encouraging, but telling people living with HIV that they should not have families. So you may be thinking, why is this guy going on about reproductive health at the STI pre-conference? So let me turn back to the main question at hand for this meeting, STI services for people living with HIV. This is a question for you. We don't have a keypad, so here are all the answers as well. Do you think people living with HIV are receiving the services they need to prevent and treat STIs in your country? So in a moment, I'll ask you to raise your hand, responding to either no, services need to be improved to care for comorbidities, in people living with HIV, specifically STIs. Somewhat, only some areas have suitable services available. Yes, suitable services are available, or do not know. We already heard from the first speaker different examples from Denver, New York, and Amsterdam. Now thinking about your country in general. How many people think people living with HIV are receiving the services they need? 1, no. Okay, I don't see too many hands. That's good. 2, somewhat. A lot of hands. I think we have a winner. Yes. Good. I already see a couple people I know from the Netherlands responding. Well, I won't ask others where they're from, but and 4 do not know. Well, I don't see any do not knows. Do not know would be a very fair answer, because what I'm going to present now is some of the research we're carrying out that looks at how health systems are responding to the current situation, but also what we know from the health system about STI and other comorbidity surveillance issues. So the HIV Outcomes Beyond Viral Suppression Research Plan has a central question: how are health systems performing in relation to the changing clinical and psychosocial realities facing people with HIV in Europe as we go beyond viral suppression? We believe, as I mentioned, that insufficient attention is being paid to long-term health outcomes and quality of life. Here's our paper from a couple years ago, where we put forward the idea of a fourth 90 related to health-related quality of life, be it clinical or be it self-perceived quality of life. The jury is still out on how we will measure that, but we want to make sure that HRQOL is on the agenda in all settings. So this short study that I'll present briefly now, an 18-item English language survey drawing on our earlier literature review, 7 sections. Here I'll just mention the parts on comorbidities and HRQOL. And we first piloted this in 6 countries, including the Netherlands, but also including Turkey. So we're trying to get a little bit out of the EU, and we will soon expand this across the entire WHO European region of 53 member states. So again, when you see the answers here, remember they're only from 6 countries. And just in the nick of time, we finished it 3 weeks ago and finished writing it up, I think, about 2 days ago. So sorry for the stress at the Speaker Center and getting these slides to you. Our findings. Don't worry about all the details in the table here. The first question around service access, comorbidity, screening and testing in people living with HIV. Draw your attention to the bottom left where it says sexually transmitted infections. The overall finding was that many countries cannot monitor screening and testing for several comorbidities, although they have a high capacity to monitor, not surprisingly, for TB, but also, thankfully, for viral hepatitis. What you see down here on the left with sexually transmitted infections is, does national HIV monitoring include reporting on indicators that ask whether people living with HIV are offered screening or testing? The answer was 1 of the 6 countries responded yes. 2 said they could modify their surveillance to be able to answer it, but they don't. And 3 said they simply do not ask anything related to this. And then on your right, does national HIV monitoring include reporting of indicators that ask whether PLHIV are actually screened? Here, 3 countries reported this. The other 3 do not report this. So the take-home message here is that around being offered screening or actually being screened or tested for STIs, half of the countries are not studying this issue at the national level. It doesn't mean that we have no idea what's going on. There are good cohort studies in many of these countries, but as we move into the beyond viral suppression era, we need to make sure that our health systems monitoring follows along. Service access related to comorbidity diagnosis and treatment. Again, HBV, HCV, and TB are the most widely monitored. In terms of STIs, you can see the circle on the bottom left. In terms of diagnosis, 1 country is currently reporting this, and in terms of treatment, none of the countries could respond positively to the question, does national HIV monitoring include reporting on indicators that ask whether people living with HIV are treated for STIs. So for me, this is a quite shocking result. Does it mean that people are not getting treated? Of course not. But do we know what's actually going on in the country? We do not. In terms of comorbidities and polypharmacy and clinical guidelines, we asked about the inclusion in national HIV clinical guidelines of these issues. Some guidelines do not include recommendations to screen or test for widespread comorbidities, including STIs. 3 do not include recommendations to screen for polypharmacy. As the population with living with HIV is aging and increasingly over the age of 50, polypharmacy is increasingly prevalent, and we need to know how many medicines people living with HIV are taking, and the national system needs to understand that to be able to address issues not just related to drug-drug interactions, but also adherence. Discrimination is a crucial issue in the care for people living with HIV. We often talk about stigma, but we know that there is discrimination within the health systems. Few countries report on this important indicator. We asked, of all people living with HIV, what percentage report being denied health services because of HIV status in the last year? 2 countries could answer. We can also question the quality of those responses, but at least they are asking about discrimination in the health system. When I speak to people living with HIV from around the world, they all report discrimination as a major issue. When we asked the countries if they're able to monitor this, we find that they do not. That needs to change. And finally, back to Mario and anyone else living with HIV who wants to have children. The desire for children and the need for preconception planning among people living with HIV, no countries are reporting on this issue. Again, we have a small sample size, and few countries have the capacity to report on our proposed indicators. Health-related quality of life, as I mentioned, what we're calling the fourth 90 and what we believe needs to be picked up at the global, national, and subnational levels. Of the 6 countries we surveyed, 1 country is currently reporting health-related quality of life. 2 others have the capacity to do so. That answer came about during our pilot of this pilot, where countries said, well, we don't do it, but we could. 3 simply do not, and said they do not have the capacity to do this. I think elsewhere the data from the European monitoring system, the Dublin Declaration, will be shared, and there you'll find that 5 of the European countries are reporting HRQOL. That's great, but it's still a very, very low number in terms of the need for understanding quality of life. So what can we conclude from this small study? Well, the study countries have monitoring gaps across key domains, including STIs, discrimination within the health system, the desire for children, and HRQOL. Overburdened national monitoring systems cannot be expected to take on more than a few new indicators, so we really need to give a think about what are the most important indicators to put forward to national surveillance systems. Our friends who collaborated with us from the surveillance agencies asked us to be sure to mention that we need to minimize the reporting burden by prioritizing carefully and aligning with current indicators and monitoring activities. So let me also conclude with a few recommendations that the HIV Outcomes Coalition has come up with. We had over the past year, well, the year ending in November, so a year and a half ago, we started a multi-stakeholder process to discuss recommendations related to long-term health and well-being of people living with HIV. We identified priority issues at 2 expert roundtables. We had a workshop to develop recommendations last September, and we presented this together with the European Commissioner for Health at the European Parliament just before World AIDS Day last year. The recommendations, there's just 5, and I won't go into so much detail except for this first one, were to adopt an integrated, outcomes-focused, and patient-centered approach to long-term care. This should put comorbidity prevention, treatment, and management at the center of long-term HIV care, should coordinate outcomes-focused care delivery using a personalized care plan to integrate services for mental health and neurocognitive impairment, and to ensure an ongoing focus on sexual and reproductive health and increase the systematic participation of people living with HIV in decisions about their care. The other 4 recommendations are to expand national monitoring of long-term care and outcomes, to fund studies to provide information on the long-term health of people living with HIV, to combat stigma and discrimination within the health system. It should be combated everywhere, but we're focusing our work on the health system, and to upscale the involvement of the HIV community in priority setting at the country level. A lot of people have been involved in the outcomes work. Let me specifically acknowledge the study group participants. A few of you are here in the room. Thank you very much, as well as for facilitating me being here to present our work. And I don't know where the thank you slide is, but thank you very much.